This is my client, Lisa, and she's had several traumas to her low back and pelvis. And when we evaluate spring through the entire pelvis on the left side, it's very easy for me to compress it to an end point and then impart spring, and it bounces right back. When I do the same test on the right, I can't really take up the slack. And the other thing that I notice is this part of her pelvis raises up immediately. Okay? And so this would be named a right anterior ilium, but in truth, it's, to our best understanding, it really isn't the ilium rotating on the sacrum. It's actually the whole pelvis moving with the hips. Now when we check the pubic joint, she actually does appear to be slightly lower on the right side. And I'm sure the camera view can't see that. The pubic bones are symmetrical on the front of them at the upper third and at the middle third. When we come to the lower third, there's a distinct step off. I can walk across and I'm on top of that thumb. So we call that a lower pubic rotation. Would you lie on your stomach, please? It's an interesting case because there are several things going on together which we don't usually see. The left sit bone is lower, and she certainly does have pain with sitting, and I'm not able to take up the slack going in a superior direction. It just feels like I'm trying to push a block of concrete. On the right side, you can see that her body allows movement, and I can move the pelvis upward to a stop point. So I've taken up the slack in the system, and I can then impart a little bit of force, and her whole body springs and it recoils. There's a ligament down here called the sacrotuberous ligament, and this ligament I can indent with my thumb, and I don't know if the camera view captures that or not. On this side, that ligament is more prominent, and it's very hard. It should feel like a ligament. It should give a little bit when I push down, but it doesn't. It actually feels like a bone. Now, the other thing that she has is a rather deep, what's called a sulcus, on the left side of her coccyx, and that indicates a left side bent coccyx. And noted in sitting, I don't know if we're going to see this with her on her stomach, and yes, we actually do. She presents with what we call a sacral torsion. I can create some movement going through her body on the on the right lower quadrant. When I come to the left side, it's blocked. That motion is blocked. When we come on the upper quadrant on the left, there's movement. And when we come onto the upper quadrant on the right, there is movement. She also has asymmetry of her hip extension. The left hip extends about 15 degrees. And the right hip, hardly at all. I'm even reluctant to call that 5 degrees, but yeah, we'll go 5 degrees with that. Distinctly less on this side. So there is a lot going on with her structure here, and there's a compensatory pattern in the upper body in which the head is positioned in left rotation and right side bending, and that's a little hard to demonstrate on the camera. So I just want to present this case because there's much going on. I don't often see this number of things, this number of individual patterns within a pelvic presentation. And there certainly is controversy on sacroiliac dysfunction, and we know that some of those things are overstated, but clinically we can demonstrate loss of force transmission, loss of movement going through the body. And in this example, I do believe that the pubic joint is shifted, and I believe that this is a genuine type of sacroiliac joint dysfunction, which the left hemipelvis has shifted downward in relationship to the coccyx. And it may be that other models emerge in time that's not been studied. That particular pattern has not been studied, nor has that lower pubic rotation pattern been studied with any of the research. But I'm going to stop here, and we will treat her and we will film her response to treatment.